Hi everyone, and welcome to this week's class, Impacting Change. This week we will be talking about how nurses can influence policy and some of the resources available to influence policy. We also will go over some of the assignments related to this topic, namely the paper that we'll be doing at the end. So you may ask yourself, well, why do I have to get involved in policy? I want to take care of patients. I want to improve their health. Let someone else deal with what's going on in Washington, D.C. It doesn't concern me. But what has been propagated lately or has been found out through the Institute of Medicine is that there are key recommendations for nurses going forward to improve the health care of our nation. So there was 4 of these, but we're really going to focus on the third one. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And that really speaks to policy. The 4th recommendation, effective workforce planning, is kind of the little p. We're talking in this course about the big P. So little p is the policies that are done around your healthcare organization. We're talking about broader national and state policies that are created. So how can a nurse get involved at that level? So to further the report, The Future of Nursing, Robert Wood Johnson supports the research agenda set forth. So some of these recommendations were, let's do some implementation in nursing training, education, professional leadership, and workforce policy. So we're really looking at the professional leadership in this course. The Robert Wood Johnson's Foundation developed a resource manual for constituents that wanted to get involved with their Congress. So how could they do this? Sometimes it seems like an overwhelming task. Little old me, gonna go and talk with the congressman? I'm afraid. So what this Connect manual did is really outlined all the steps that you need to take. And there was important healthcare issues such as improving healthcare quality, reversing the epidemic of childhood obesity, building the healthcare workforce, ensuring that all Americans have access to affordable healthcare coverage, improving the public health infrastructure, and reducing harm from tobacco, alcohol, and other drugs. All very worthy causes. So some of these steps in the resource manual were: learn about your congressional delegation. Develop a meeting strategy. So present a compelling introduction, tell a story, make an ask, create strong leave-behind materials. This could help you navigate Capitol Hill. And then finally, they focus on how you're going to follow up with this. In the paper, the assignment that's linked to this course, or linked to this week anyways, is the Impacting Change paper. So in this paper, you're going to identify a bioethical issue. You're going to look at the position statement of nursing with regard to this issue. And then you're going to identify national, state, and/or health organization policies and stances surrounding the issue. Look at what recommendations or suggestions that you may have or modify. You will also be asked to develop a 1-page ask sheet to communicate your issue to a key stakeholder. So the first step really is going to be finding your healthcare issue that you want to focus on in your paper. So there are examples everywhere in the internet, but Robert Wood Johnson does have the ones that we reviewed, and they have policy briefs on their website that cover the childhood obesity, disparities, healthcare cost issues, healthcare quality, health insurance coverage, public health and prevention, and workforce-related issues. You can either choose one of those issues, something else you find on the internet, or something that's a little bit more personal to you, something that you actually encounter in your practice. For example, I'm a diabetes educator, so I was wondering what the position statement of the American Association of Diabetes Educators was on telehealth, because that's something that I'm really interested in. So I went to their website and I looked up their position statement there. And the American Association of Diabetes Educators they're really involved in trying to improve access to diabetes self-management education. In their policy statement, they said their position statement, they said how certified diabetes educators are not allowed to bill for diabetes self-management education or to get reimbursed by it. So what they are doing is they are formulating a position statement to communicate what their desired state would be, and that would be that diabetes educators would be able to get reimbursed. And this is for nurses. Interestingly enough, registered dietitians who are CDEs can reimburse for their time with diabetes self-management education. So now I found an issue I'm interested in. I found some position statements from a national organization. And now I look at what kind of action is already out there being done. So I found the bill, the HR 5380, the Medicare Telehealth Parity Act. So this would be able to make all healthcare professionals on par with each other. They would each be able to get reimbursed for diabetes self-management education. So the next step is really saying, okay, well, who would I talk to about this? I found the bill. So there is a website that you can go to and you can look up the bills and who's sponsoring them. For this one here, it's Republican Representative Mike Thomas, who's a Democrat from California, Representative Greg Harper, and he's a Republican, and Representative Peter Welch, and he's a Democrat. So since I live in California, I thought I'd try and find out a little bit more about Mike Thompson. So it was interesting that I could go to the website and pull up a profile about Mike Thompson, what he's interested in, a little bit about his background and his family history. It turns out actually that his daughter has type 1 diabetes. So this diabetes issue is something that's near and dear to his heart. The next step, according to the Connect manual, is to develop an ask. So ask is really just policy speak for a specific request that you make of your policymaker. So I'm going to ask Representative Thompson about something that is actionable, so something that he can actually change or impact, something that's linked to his interests, like diabetes, we found out was, and something that advances your work. So my work as a diabetes educator, if I could get reimbursement for this, that would mean I would be able to access more patients, and they would be able to access me or diabetes self-management education that I provide. The final part of your assignment is to really put this ask into a one-page communication sheet that you can leave with the representative. They don't always have a lot of time, so it's nice to have something concrete with your message clear on it that you can leave with the congressman. So they really, the Connect manual goes through, it has several examples of one-pagers, and it recommends that you use your project's letterhead. You use special headings, bullets, and font styles. Include complete contact information. Now, I just zoom this in a little bit so you can see I have the contact information here. I created a group, the Alliance of CDEs from Azusa Pacific University. So it says to include the date. So I have the date that this was created up there. It says give a concise explanation of your program, and make sure you don't use any jargon. So make sure that's, medical jargon is words that you would understand, but the congressman might not necessarily know. So make sure it's clear language. It also says to give a few facts and figures, some background about the issue. So I put in the prevalence of diabetes, the estimated cost of diabetes to the U.S. I also put in the number one reason for patients not receiving diabetes self-management education was lack of access. Put in the solution. Telehealth studies show that DSMT, DSME, education or training, delivered by web-based and mobile technologies have demonstrated positive patient outcomes. And then the goals, what do I want? So parity for in-person telehealth DSME, improve access to DSME. So that's really it. I've included the references here from the Robert Wood Johnson and the Institute of Medicine. I will also put those in the resource section in your Sakai companion. If you have any questions, please don't hesitate to give me a call or send me an email.